what exactly is Morpheus8 and how does it work?
Morpheus8 is a brand name actually.
Okay.
It's not the technology. The technology is microneedling with radiofrequency. Now how Morpheus8 works. So like I mentioned earlier, technology is microneedling and radiofrequency.
Yes.
So microneedling, we make small punctures on the skin like in a fractional way similar to lasers. So that helps in collagen production and helps in elastin production as well, whereas radiofrequency delivers high energy or heat deeper into the skin, so that also helps in tightening, skin tightening, textural changes in skin, and it also helps in fat reduction in certain areas if you go at really high heat.
Okay. So doctor, what is the major difference between Morpheus8 and other MNRF treatment devices?
So Morpheus8, like I mentioned, is MNRF, where microneedling with radiofrequency is used for collagen production, for skin tightening, etc. Now, how it is different from other devices? Morpheus8 basically can go really deep, up to 7 millimeters, especially for the body. We have different tips. For example, the face tips goes up to 4 millimeter in depth, and the body goes to 7 millimeter. So that can help in reducing fat in certain areas at really high energy because it's much deeper.
Oh, okay.
Yes, and also it can be used in skin tightening. It's also very precise. As in, like, you have different depths for different areas, so that can help in fine lines and wrinkles and also textural differences.
Really? So doctor, what are the uses of Morpheus8 and what all it treats?
Okay, so Morpheus8 is an FDA approved machine that helps in collagen remodeling and elastin production in the skin. So it's used for various indications. For example, it helps in reducing skin laxity.
Right.
Yes, and also sagging.
Okay.
So basically for facial contouring when it goes deeper in. So another indication that Morpheus8 is good for is acne scarring. Like I mentioned earlier, for after post acne, a lot of people do get box scars or rolling scars.
Yes.
So Morpheus8, because of its microneedling purposes, it can help in breaking the fibrous tissue underlying the scarring, so that the scarring is not as evident later on. It can also be helped for people that have large pores.
Okay.
So it improves skin texture by increasing collagen and elastin production. So the appearance of pores are improved, and also the skin texture is improved. So therefore, less number of fine lines and wrinkles over time.
Okay.
So Morpheus8 can also be used in stretch marks. Similar to the action in acne scarring, it also helps in breaking the bonds in stretch marks. Yes.
Okay.
And helps in collagen elastin production as well. So appearance of stretch marks is vastly improved over time.
So doctor, after how many sessions one can see the result with Morpheus8?
Great question. So a lot of patients do want to see immediate results.
Yeah.
However, that's not possible. Now again, to see results with Morpheus8, it will depend on why the patient is coming to me. For example, if it's just for textural differences, you can see after 1 or 2 sessions. Collagen remodeling takes place in about 21 days. So there will be slight difference there, but not a significant result, like, that you can see visibly.
Got it.
And if a person is coming, for example, acne scarring or stretch marks, you need at least 4 to 6 sessions before you see significant results. And if it's for fat reduction, for example, abdomen or double chin area, you need at least 6 to 8 sessions.
Okay.
Yes.
And how does the results last?
So results after the initial 6 to 8 sessions, they have to come for maintenance sessions once in about 4 to 6 months. Sorry.
Okay. So doctor, what makes Morpheus8 worth the investment as compared to other similar treatments of MNRF?
Good question. Morpheus8 is a dual technology. You have microneedling and radiofrequency.
Yes.
So with microneedling, the microinjuries take place in your skin that boosts your natural healing process within it, and therefore boosting collagen and elastin production. Whereas radiofrequency delivers heat deeper into your skin by passing the top layer and then causing contouring, facial contouring.
Yes.
So because of the dual action, obviously it is worth the investment. Another point is the versatility. So it's used for a large number of indications. For example, anywhere from facial contouring to double chin reduction, acne scarring, stretch marks. So because it can take care of a wide range of indications, yes, I would say it is one of the better treatments implants out there. There's minimal amount of downtime with Morpheus8 treatment, anywhere from 2 to 5 days, and the patient is good to go. Of course, there might be slight scabbing post-treatment, which can be taken care of with a good aftercare. The next is a long-lasting results that you see with Morpheus8. The initial treatment phase, obviously the patient has to be a bit more regular at the clinic. The treatment sessions are spaced around 4 to 6 weeks apart initially. So after the initial treatment phase, they go into maintenance. So the treatment lasts much longer rather than keeping on every 2 months. And this is great for patients who don't want to undergo knives. Basically, they don't want any surgical intervention. Yes, so it's good for those kind of patients where they want a slight reduction in their double chin area or small pockets of fat here or there. It's also great for facial contouring for those patients with mid to mild laxity. Like I said earlier, my Morpheus8 has dual action, microneedling and with radiofrequency. So the results are much better than either microneedling or just radiofrequency devices. So compared to Botox and fillers, because they are the anti-aging device treatments, Morpheus8 is used for facial contouring and also fat reduction, whereas Botox are used for dynamic lines, basically to relax muscle for anti-aging purposes, and fillers are for people who have extreme amount of volume loss or want a more contoured cheekbone. That's when we use fillers. I would say Morpheus8 can be used in conjunction with both Botox and fillers rather than, replacing either or.
Okay.